Hello, hello, hello. Happy Thursday. How is everybody doing? I want to say hello to everybody that is watching in the Clinical Connections Mentoring Facebook group. Hi to everybody that is watching on Instagram. So happy you are here. I hope everybody is having a great week so far. Suddenly we're in November. I cannot believe it. I don't know about you. But for me, 2023 has certainly flown by. So thank you again to everybody that is watching today's live stream. I am so happy that you are here. I am happy to be here. Um, I've gotten a lot of requests to talk about motivational interviewing. So that's what today's live stream is going to be about. The number of requests I've gotten to cover this topic has been a lot. So I'm like, okay, fine, let's do it. So I'll be talking today about all things related to motivational interviewing, what it is, how to use it, kind of really how to answer the question, how the heck do I motivate my own patients? So most people will agree that one of the most frustrating things when working with your patients, whether you're a PT, an OT, a speech therapist, is just finding ways to motivate our patients, especially the really difficult ones. You know what is best for your patients, but it can be super frustrating when your patients don't see it that way, right? And you know deep down that exercise and movement and walking are really, really good for all of your patients. You know all the science behind it, and you try to tell them that every session. You can spit out the facts and the research and the proof as to why this is good for them and why it's so helpful for them. But some just don't want to hear it. Some just don't believe it. Some just seem lazy and don't want to do the work. Then you start to get frustrated when they don't comply. You get frustrated when they don't achieve their goals. You get annoyed when they stop showing up for their appointments, right? Who's been there, right? Drop a me in the comments if that's you. If you've told them all the reasons why these things are good and they're still not wanting to do anything. Then you get frustrated and they stop coming. So today I'm here to help you figure out what will work, what will motivate your patients. So for anybody new here, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads, whether PT, OT, speech, any therapy realm. I'm a mentor for students and new grads. I've worked in just about every setting that exists for the past 16 years. Acute care, oncology, outpatient, home health, pediatrics, early intervention. I have done skilled nursing facility. I've been a rehab director in a skilled nursing facility. And now I own my own cash-based practice where I work mostly with gymnasts here in the Tampa area. And I'm also owner of Clinical Connections Mentoring, which is where you are today. So again, thank you for being here. What I'd like to do first, before we kind of get into all the nitty gritty, is if you are watching live, please type live in the comments, whether you're watching on Instagram or you're watching on Facebook. Tell me who you are, where you're watching from. Same thing if you are watching the replay, go ahead, type replay if you're watching. Tell me who you are, where you're watching from. Just kind of like to know who I'm talking to. Go ahead and also, while you're in the comments, I want you to tell me, what have you done to motivate your patients? What have you found to be really effective as a way to motivate your patients? Give you a minute to do that. Okay, so as a newer rehab therapist, again, whether it's PT, OT, speech, you have likely been told that some people are just lazy. They don't want to do the work. They can't be motivated. But I'm here to tell you that that is not entirely true. There is always something that can motivate a person. Your job is to figure out what that is. And that's what I'm going to help you kind of discover today. And it starts with motivational interviewing. So if you've been around here a while, you know that I often say that communication is key. And this is absolutely true for your patients and your clients. The key to motivating your patients so that they start to feel better, they trust you, and they want to keep coming back to therapy and actually reach their goals starts with communication. If you can't communicate effectively with your patients about what they need or what they want, you can feel frustrated and you start to feel kind of helpless as the therapist, right? If you can't communicate effectively with your patients, they're not going to be able to trust you. So if a patient doesn't trust you, and you don't know what they need or what they want, how are you going to be able to help them? Today, that's going to change. I'm going to help change that for you. Okay. So let's start with, what is motivational interviewing? So by definition, motivational interviewing is a collaborative style of communication designed to strengthen personal motivation and commitment to a goal. It uses the person's own reasons for change to determine the route to achieving that goal. Okay. It's guided communication designed to empower people, empower your patients, right? Specifically your patients. It uses the patient's own meaning and their own capacity for change. Okay. So it focuses on patient autonomy. So in other words, the client is driving the bus, or the patient is driving the bus. It gives them the power to make the choice and then ultimately make the change. Okay. So the patient is telling you what is important to them and why it's important to them. By asking the right questions, you're able to pull out that patient's priorities, their values, and their knowledge to find the path to change and success so that you can help them reach those goals. Okay. So as a therapist, when you're doing motivational interviewing, I'd say whether you're doing motivational interviewing or not, your role is to be non-judgmental when your patients are talking to you. Okay. Your goal is to understand their perspective and their past experiences. Okay. Your job is to be empathetic toward them, respect their choice to make a change or to not make a change. Okay. It's really easy for us in the rehab world. We know that in most cases, change is what's best for the patient. And so it can be easy to get frustrated and upset when a patient doesn't want to make a change that is good for them. But our role and our job really is to just be empathetic toward them and respect their decision to not make a change if that's their decision. Okay. It's easy when they do want to make that change, but we also need to respect when they don't want to make a change. Okay. So with motivational interviewing, you can empower your patients, get them involved in their own goal setting. You can ask the right questions to get the best answers because your patients, they know their own barriers and they know the best way to reach their goals. Ultimately, with all of that, you'll find the motivation that each patient needs to reach those goals. Okay. So now let's talk about some of the basics of motivational interviewing. The acronym to remember is OARS, O-A-R-S. Okay, so O is those open-ended questions, asking open-ended questions that will help to explore the person's experiences and their perspectives, and it helps the patient to reflect on how they can make those changes. Okay, so that's O. A is affirmation. So it's affirming their strengths and their past successes to help build up their confidence. Okay, that's affirmation. The third one is R, reflective listening or reflection. So it's actively listening to what the patient is telling you and rephrasing it and repeating it back to them. Okay, so that's R, reflective listening. And then the last one is summarizing, S. So it's showing understanding of what the patient has told you, and it reinforces some of those key points that the patient made during the entire conversation. Okay, so let's go a little bit deeper in each of those, the OARS. Okay, so we're gonna start with O, so the open-ended questions. So these help to build rapport and establish a safe environment. I would say this is almost key, right? Because if the patient doesn't trust you, you don't have a rapport with them, they don't feel safe with you, the rest of the stuff isn't gonna happen or even work, right? So you have to build rapport and you have to make sure that patient feels safe during this conversation, okay? That comes through open-ended questions, okay? By asking these open-ended questions, you're supporting a respective relationship between you and that patient. You respect them, they respect you. It lets you explore and gain a lot of clarity on just the patient themselves, okay? It gives you a better understanding of their perspective, where they're coming from, how they see this entire situation. Okay, whether it's pain, shoulder pain, back pain, maybe it's they've had a stroke and they have all these functional impairments. It gives you the ability to better understand their perspective of their current situation. Okay. It lets you learn more about their past experiences, maybe their current experiences, their thoughts, their beliefs, their values, what they think is important, their hopes, and definitely their goals. Okay. The patient does most of the talking here. Okay. That's why they're open ended questions. You ask the open ended question and you let them answer. Try not to interrupt them. It's really easy to do, but you ask your question and you stop talking. You give them the opportunity to answer that question. Don't interrupt them. Let them finish their thought, right? Open ended questions, again, quick review, open ended questions are not yes or no answers. There should be a pretty lengthy response to your open ended question. Okay. So, I'll give you some examples of what a good open ended question is. One would be, what type of exercises do you do each week? Right? That's open ended. They can then tell you everything. And you can ask some follow up questions to dig up a little bit deeper. Tell me more about how far you walk. Tell me more about how much weight you lift at the gym. Okay. Versus a closed ended question would be, do you exercise? Doesn't really tell you anything. But if you ask it open ended, so what type of exercise do you do each week? They can give you way more information, right? Another example would be, how do you think your pain is limiting you right now? They will tell you. You may, again, have to ask some follow up ones, but how do you think your pain is limiting you right now? And another example is, what do you want to be able to do when you leave the hospital or the rehab facility or this skilled nursing facility, right? What do you want to be able to do when you leave here? Okay. All of these types of questions, asking them this way, opens up the conversation. And open ended questions. Okay. It opens the conversation. It gets that ball rolling, it starts the conversation. Okay. All right. Now let's talk a little bit more about affirmations. So the OA. Okay. Affirmations, again, they help to build rapport between you and the patient. What you're doing here is you're affirming their strengths and their abilities. So you're affirming back to the patient what they already have as a strength or an ability. Okay. This helps your patient to then gain more confidence in themselves and confidence to work towards their own goals. Okay. Excuse me. When you affirm your patient, you are then sharing the belief that they can be responsible for their own decisions and choices. Okay. When you affirm your patient, you now share their belief that they can be responsible and they can make choices. Okay. Examples would be saying things like, it's great that you're here today. It's not always easy to come to therapy when you're hurting, right? Or, I know that you're trying really hard to whatever they've said. Okay. Another example would be, it seems like you're really good at whatever they've told you. Okay. So if a patient says, I really want to go back to work, even though I know it'll be difficult, a good affirmation to what they said here would be, that's really awesome that you want to go back to work. That's such a big mindset shift from where you were 2 weeks ago, right? So you've affirmed a strength or an ability of their own that they've already told you about, right? And then you now share their belief that they're responsible for something, that they can do something. Okay. All right. Now let's talk a little bit more about reflective listening. Okay. This is when you listen to what your patient is telling you, which we do. I think we are better at that than most healthcare providers, but it's really just listening to what your patient is telling you. You're observing them. You're reflecting back to them your perceptions of what they've told you. So they've told you something. You're listening to them, you're watching them, and then you're reflecting back how you perceived what they said to you. Okay. You can reflect back what they said, what their emotions were, or what their behaviors were. Okay. This shows your patient that you're listening, which is really what they want. Okay. They want to be heard, because chances are, by the time they've come to you, there have not been many other healthcare providers that have heard them or listened to them, right? Luckily, as therapists, most of us have that ability within our schedules to spend some good amount of time with these patients and actually listen to them, let them be heard. That is what they want, right? If you think back to any of your visits with your primary care physician, or even maybe you're a gynecologist or whatever, it's in and out 5 minutes, right? They've probably been gaslighted a lot along their healthcare journey, especially if they are somebody who's having chronic pain. They probably haven't been listened to, right? But by the time they get to us, we do have the ability to listen to them. We have so much time with them. We can listen to them. That is what they want. They want to be heard. Okay. When you reflect back your perception of what they've told you, your patient, sorry, hang on 1 second. When you reflect back your perception of what the patient has told you, your patient then gets the opportunity to hear that back, and they get to hear your experience of what they've told you. Okay. I'll give you some examples of reflective listening. So, using their words. So, I'm hearing you say that you really don't want to exercise right now. Okay. Example of using their emotions. You seem to be really frustrated with whatever you noticed with them during the conversation. Okay. Example of reflecting their behavior would be, I noticed that you smiled when you said this, or I noticed that you kind of got a little like you were fighting back some tears when you said this, right? So again, you can use their own words, their emotions, or their own behavior when you're reflecting back to them. So if a patient says, I'm afraid I'll damage my shoulder if I push through the pain. So a good reflective response would be, I'm hearing you say that you're scared to hurt your shoulder more, right? So that shows the patient that you heard them. You notice the emotion, you recognize the emotion of what they're telling you, which is fear, which a lot of people have, right? Okay. Well, let's talk about the last one. So, summarizing. So, this just recaps the entire conversation. So, it starts at the beginning of the conversation, right? And this part, your summarization, moves it to the end of the conversation. It's kind of lets the patient know this is we're done here. Okay. It checks that you've understood what your patient has told you, what they've said to you, what they've said their goals are, and what their preferences are on how to get to those goals. Okay. It confirms that you both are on the same page for what the plan is moving forward. Okay. So, some examples of how you can summarize would be, so let's go over what we talked about today, and then just reviewing everything they've said to you, the emotions, the behaviors you've noticed. You can throw some reflections in there, kind of the conclusion, the plan that you both have agreed on. Okay. Another example would be, so just so that I understand, this is what you've told me, blah, 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 blah. Okay. Another way to reflect is simply saying, a minute ago you said you wanted to start exercise. Would you like to talk more about how you want to do that? Okay. That kind of brings it back together. Now let's create that plan. Okay. Now, I know that's a lot. So if you ever get stuck and you can't remember all those components to motivational interviewing, you can always ask these 4 questions. So if you've got a piece of paper, go ahead and write them down. You can ask, why would you want to make this change? Ask the patient, why do you want to make a change here? Okay. You can ask, what are the 3 best reasons for you to do this? Remember, you know why, but the patient needs to understand why. They need to kind of look inside themselves, and they need to come up with if they can come up with 3 reasons themselves, that's going to motivate them. So the question is, what are the 3 reasons for you to do this? They will pull them out, and that will start to motivate them. Okay. Another question, on a scale of 1 to 10, how important is it to you to make this change? Right? If they give you a number, why is it not a 10? If it's not a 10, why is that? What can make it a 10? Okay. And the 4th question you can ask is, if you did decide to make a change, how do you think you'd go about doing that? Again, this makes them kind of reflect internally. So if I wanted to be able to walk a mile, how would I do that? Then they're telling you the plan that's going to work for them. You don't have to figure it out. They're going to tell you. Okay. It's a really good question to ask, make your job a little bit easier. Okay. If you still get stuck here with those 4 questions, it's okay. I know it's a lot. A lot. Motivational interviewing takes a lot of practice. It's not going to happen tomorrow. It's a lot of practice. So, probably maybe the easiest place to start is just asking your patients this question: what do you want me to help you to be able to do? Is there something that you can't do right now that you want to be able to do? Let's figure out a plan together to get there. Okay. So if you can't remember, you got a patient in front of you, you're not really wanting to do it, you're having trouble motivating, you can't remember all the steps and all the questions for motivational interviewing, just start with, is there something that you can't do right now that you want to be able to do? Tell me what it is, and let's figure out a plan to get there together. Okay. So the big thing to notice here is that at no point are you telling the patient very much, right? Telling your patients how they should feel or what they should do is not going to be helpful for your patients, especially those who are not motivated. Telling your patients the research, spitting out all the facts as to why a certain intervention is good for them, not going to be helpful, especially for the unmotivated ones. Okay. Instead, you're letting the patient drive the conversation. You're asking the questions, and these questions allow the patient to kind of pull forward those answers to their problems. Remember, ultimately, the patient has all of the answers. Okay. They are the only ones that know what is best for them. They know what's going to motivate them. They know the best path to get them to reach their goals. Okay. You're asking the questions, you're affirming what they say and how they feel about it, you're reflecting back what they've told you, and then you're summarizing the conversation. By doing all of this, the patients will be able to self discover what is needed to get motivated. Your job is simply to support and guide them as they move along that path that they've decided to take. Okay. You certainly can help them if they get stuck or they don't know what to do. Then you can kind of tell them a little bit. But ultimately, they will tell you the plan and how they want you to help them get there. Okay. Remember also, this is a collaboration. And in order to collaborate with your patients, you need to be able to communicate with them effectively. Okay. You're asking the questions, they give you the answers. Together, you formulate the plan to get them towards those goals. Okay. Helping therapists discover how to better communicate with their patients is just one of the areas that I like to guide newer grads and even seasoned clinicians to figure out how to do best within my complete clinician mentoring program. Okay. The steps that I shared with you today for motivational interviewing are really, really good place to start. And like I said, it takes a lot of practice. So if you want more practice or you feel like getting over that communication hurdle is or maybe has been a real struggle for you, reach out to me. Send me a message, send me a DM. Let's chat. Maybe drop a complete in the comments, whether you're watching on Instagram or you're watching on Facebook. Go ahead and drop complete. Okay. I'll reach out to you. Communication is absolutely the key to success and happiness for your patients, but also for you in your career. And it's certainly the key to helping your patients reach their goals. Okay. Let me help you figure out how to strengthen that very, very, very important tool so you can continue to enjoy your career, right? It's really easy if you got a whole caseload of unmotivated patients to start feeling that burnout. Okay. I don't want that for you. Let me help you figure out how to better communicate with them so you can help them reach their goals. Gives you a little shot of dopamine, right? And then you can enjoy your career again. So I hope you learned something new today. Please go ahead, drop in the comments, again, whether on Instagram or in the Facebook group, go ahead, drop your aha moments or something that really kind of stood out for you today, maybe something new that you learned. I do want to thank you again very much for watching. If you have any questions about what I talked today, like I said, feel free to message me, drop a comment in the questions. I will come back and I will answer questions. Even if you're watching the replay, I will come back and answer any questions that you leave. But I really hope this was helpful for you today. Thank you again, and I will see you next time. Have a good day.